Hi, Dr. Vishakha. Good to connect with you. And also, we are very happy to know that young aspirants and who are from the dental background, from who are right now doing their PG, are also actively involved in 3D printing now. And also, now that you're also a 3D Graphy panel member, we appreciate your being a part of this, because we will also get to know what is the young aspirants mind for 3D printing. Also, now that we are not only restricting ourselves to 3D printing, we are also into various other technologies like AR and VR. And somebody who comes from the background as doing your PG in oral maxillofacial radiology, I'm sure it will be of great benefit even in your career path going forward. So let me congratulate you, Doctor, for being awarded the 3D Graphy Medical with the 3D Graphy Medical Awards for the Young Aspirant Dental Student of the Year.
Thank you, sir.
Yeah. So you can just share with us your brief in terms of where it all started. What was the journey? Just sharing your journey and your experience with 3D printing and when it started.
Actually, so as being in the field of radiology, maxillofacial radiology and diagnosis, I was greatly interested in the CBCT part of my curriculum. But after that, the diagnosis and treatment plan coming across in curriculum, the detailed diagnosis and treatment plan is that important, along with these advances in all these technologies. So 3D printing is the next part that is totally dependent on the computed tomography, cone beam computed tomography. So it all started where I got 2-3 cases about the cysts and tumors of the jaw and the carcinoma of maxilla and mandible, where the diagnosis was quite easy, but the treatment plan was quite difficult. With along with the CBCT. So, in conjugation with this 3D printing technology and CBCT, it became very easy for us to diagnose and for the surgeon to plan the treatment for patients. So, then I started exploring this technology, and after that, I've come across the 3D Graphy Dental Conference, and in that, I got much familiar with this technology. And then continuing with this forum about 3D printing, and now the advances like augmented reality, virtual reality, and then the tissue bioprinting will definitely take this 3D printing technology to the higher levels, and obviously it will help all of us, the young practitioners also. So you're not audible, sir.
Yeah, and we are also very happy that you have been very actively involved in the last conferences, where you had really wanting to passionately involve your batchmates and your college to actively be a part of this. And really, it's a very, very passionate move. You know, you're very passionate about this technology, and I know that you there is a lot of quest in your approach. You keep asking questions, so which also reminds me. Do you think that the educational curriculum or the structure in dental would need something? What we are actually right now working on 3D graphy, as if we are working with 3D graphy, is for the training programs for dental students across specialization for all the PG students. Do you think this is going to help and this is important and required going forward?
Yes, definitely. So it is very important to include all these recent advances in the curriculum, because in the curriculum of these 3 years in MDS, as I'm doing so with the end of first year or second year, we'll get familiar with all the basic knowledges and all the basic concepts of the our specialty, and then the advances came across. And there, if the technologies or the armamentariums are not available with us, it becomes difficult for us to understand. And that's the main reason I have observed in all those days during the invitations of our 3D Graphy Medical Expo 2020, where the awareness is also not there about this technology. So no people are interested in these technologies, because they are not even aware that this technologies exist or not. So armamentariums or these technologies should include in our curriculums, so that more people will get aware of this and more the people will able to use it, and then it will become cheaper as well.
Very
So
true. Now that when we are all talking about technology, because when there is a new technology, obviously there's a lot of investment that the companies are doing because they do a lot of research and they develop these technologies. And while they develop it, obviously when it comes to the market, they will also have a price. But with more number of absorption of this particular technology and more usage, the machines will actually get proliferated, and which means more people will buy it and more consumption will happen. So that time the as per economies of scale, the cost will also come down. So which means that the educational system, if there are aspirants like you who have come out of the college and who have taken this technology very seriously and start doing a lot of work in terms of doing their research, and maybe even buy small, I'm talking about even small FDM machines to begin with,
right, right,
which
yeah.
is now you also get to
Hmm.
even for 60, 70,000 rupees also you can get a small machine, even LCD. There are a lot of technologies. So people will start procuring it for their research and development. And while that happens, they will also learn and they will also get educated. And slowly and steadily, the cost will also come even more down, and then it will be a lot of penetration of this technology in the space, in the dental space. So good. I'm very encouraged to know that you're very active, and we also need PGs and students coming forward with that kind of a clear intention, so that we can all work together. So since we have professionals, students, researchers, technology companies from various area of expertise, uh, material science, a lot of things. So that is what 3D Graphy has to offer, and it is also our key interest to identify aspirants like you who are doing some great work and who have shown a lot of passion in this technology. So congratulations, Dr. Vishakha, for being awarded again for this particular platform. It's always an opportunity to introduce young aspirants in this space. Wishing you all the best, and we look forward to working and also getting a lot of inputs from your side so that we can come back and also ensure that these technology can be benefit for the future aspirants and students who are going to be professionals in their own way as we progress. Thank you so much and have a wonderful day. Thank you.
Thank you, sir. Thank you
Thank
so much.